Uh, yes, hello, good morning, good afternoon, good evening, depending on where you're watching me from. Yeah, I'm here to discuss a brief or details on hormonal imbalance. Yeah, here are some details breakdown of hormonal imbalance. We are going to discuss on the causes, the symptoms, the effects, and if possible, diagnosis and treatment. One, I may ask, what is hormonal imbalance? Hormonal imbalance occur when there's too much or too little of hormone in the bloodstream. Even slight changes can cause major effects throughout the body since hormones regulate most bodily processes. Now, there are key hormones that can become imbalanced. One of it is you have insulin, which is responsible for sugar control. Two, we have cortisol, which is responsible for stress response. Number three, we have thyroid hormones T3, T4, TSH, which is responsible for metabolism and energy. Sorry, which is responsible for metabolism and energy. Number four, we have estrogen and progesterone, which is responsible for female reproductive health. Number five, we have testosterone, which is responsible for male reproductive health and muscle mass. Number six of it is we have adrenaline, which is for fighting or flight response. Or flight response. Number seven, we have melatonin, which is responsible for sleep cycle. And number eight, we have prolactin, which is responsible for milk production and reproductive health. So there are common causes of hormonal imbalance. So we're going to discuss some of the list them. Probably I can discuss this later. One of the causes of imbalance, we have chronic stress, we have poor diet and obesity, and we have diabetes, that is type 1 and type 2. We have thyroid disorders, that is, and then we have menopause and perimenopause. We have pregnancy and postpartum changes, birth control pills, or hormone therapy. We have tumors, that is some call it cancer. We have benign or malignant. Malignant, that is cancer. We have autoimmune disease, e.g. we have sleep disorders, and last but not the least, the environmental toxins, which it can be plastics toxins, it can be pesticides, and so on and so forth. So there are symptoms of hormonal imbalance that we develop. Now we discuss some of the symptoms of hormonal imbalance in women before I come to men later. In women, there will be irregular or missed of periods, and then you will be experiencing heavy menstrual bleeding. You will experience acne or oily skin, and weight gain or difficult losing weight, and then you'll be experiencing infertility as well, and then also hair thinning or hair loss. You'll be experiencing mood swing, anxieties or depression, hot flashes or night sweats, and as well vaginal dryness. This is some of the symptoms in women. Now let's talk about symptoms in men. Now the number one symptoms of men, we have low libido or erectile dysfunction, that is unable to erect well, and we have loss of muscle mass, fatigue, yes, depression, weight gain, obesity, let's say obesity too, yeah. And there are some gynecomastia, which is enlarged in breast in men. When you see men have a larger breast, that can also be an hormonal imbalance, signs or symptom of hormonal imbalance. We have hair loss. Now I'm going to discuss some of the symptoms in both male and female that experience. Now we have fatigue, we have sleep disturbance, unexplained weight changes, memory problem or brain fog. We have changes in heart rate or blood pressures, digestive issues such as bloating, constipation, diarrhea, and so on and so forth. And then the increased sensitivity to cold or heat. And then there are some complications if left untreated. So if you have this kind of symptoms and you are unable to treat it, this is what is going to attack you. One of the complications is infertility. It can cause infertility. It can cause cardiovascular disease. It can cause osteoporosis, and it can develop to type 2 diabetes and mental health disorder, and as well metabolic syndrome. So there are some natural and lifestyle changes which I will list some of them, some of the natural and lifestyle changes on regard to this hormonal imbalance. We have balanced diet rich in protein, healthy fat, fiber, and micronutrients. And then have regular exercise, especially strength training and yoga. You have stress management, which can be medication, can be deep breathing. We have, and then have adequate sleep, at least 7 to 9 hours of sleep per day. And then limiting caffeine and excessive alcohol intake. Avoid endocrine disruptors. So stay safe, take care of your health, and your health is your wealth. Your health is your wealth. God bless you. If you have any challenge, have any question, anything at all, or contribution based on this video, what I have just presented, you as well, you can comment. You can drop your question at the comment section, or you can send me a DM for any related health challenges. It can be at any field. So God bless you. Thank you for listening. Thank you for watching. Do well to like and comment. God bless you. Bye.